Dr. Jim Palmer again. Again, disclaimer that we always start off. First of all, I apologize for being silly when we do this, but you know, it's part of being with patients. Number two, these are videos put together by Dr. Adappa and myself to talk about how to do things that takes care of your sinuses better. And so these officially are not directions from other physicians unless they told you to follow them and to look at them. This is just for us and our patients. Anyone else that's interested in watching, we hope you enjoy the information. So let's talk about nasal irrigation. There's two big groups. One is using the neti pot, the other is using the sinus rinse bottle. It doesn't have to be exactly the sinus rinse bottle, but admittedly, the sinus rinse by NeilMed works really well. And it's so easy to use. This is what we normally recommend for our patients. Couple things. You start off with the bottle. It's an 8-ounce bottle. So this is pre-filled here, but you either use boiled or distilled water. And I'm going to pour off just a little bit because you're supposed to be right at the line there. You can see there I am at the line. Once you're at the line, you take a salt packet and just tear off the top. You've washed your hands beforehand. We've talked about all these things about being relatively clean. And then just pour the salt in. Once the salt's in, there's also baking soda in there. Put on the top. Put your finger on the spot. Give it a few shakes. Now, you don't have plain water anymore. You have salt water or you have saline. Now, should we decide, and we'll go over in subsequent videos, putting in antibiotics, putting in steroids, putting in other things to make this saline plus those treatment areas. Next thing, when people do this, they oftentimes just put it like this, load it like this, and give it a big squirt. That is bad. Don't do that. Why? First of all, you're slamming all the saline onto your septum first, and then when your head's up like this, it's not really bubbling up into your sinuses. Let's go to the picture. This is you. If you were cut down the middle, it's officially called a sagittal view. And here's the sinuses that we want to get the sinus rinse to. Here's the problem. If you're standing up like this and you squirt it in your nose, it's going to go along the lower sinuses, come around the back, and then back out the other side. It's not getting up all in there, like I like to jokingly say, where we can get these areas treated. So take your head and 90-degree angle to the floor, all the way down like this, 90-degree angle. Remind yourself third grade geometry, because if you can do that, then when you squirt it, it's going to fill up like a tank and then dump over to the other side. Next thing everybody talks about, like, Dr. Palmer, my ears are giving me trouble doing it. And this is why. Let's go to this picture again. Right there is the eustachian tube. We're going to go up to here. Here's the eustachian tube going up into the middle ear. So if you have your head up and you slam it too hard, it's going to go right in that eustachian tube and go up this way and give you trouble with your ears. So what do I like people to do? I like them to say K, because if you watch, and we'll make some videos later to show it to you, when you say K, your soft palate pulls up, covers over that area, and then the irrigation will come around with your head dumped over. You're going to fill up your tank and it's going to dump over to the other side. Hopefully there'll be some subsequent videos that'll show some of our science behind this. We've got a pretty cool computer model, can show how the irrigation goes, and we'll cover it all. All right, so let's get back to actually irrigating. Fill the line with boiled or distilled water, add in a salt packet, or you made your own saline with our homebrew recipe. Shake it up really good. My favorite way to have people do this is then just get into the shower, because you make this up, maybe put it in the microwave, hit a button, test it a few times so it's warmed up a little bit, but it's not hot. Don't want to burn the inside of your nose. Room temperature's fine. Then, wherever you're going to be, sink or whatever, don't line it up like this. Line it up straight on. 90-degree angle to the floor. I'm going to turn so the video shows a little bit better. There, see, I'm 90-degree angle. Going to say K, and then a nice big squeeze. When you squeeze, give a nice big squeeze to your hand, touch the side, then let go, and it'll go, and it'll glug back in, and it'll be basically exactly half. That's why this 8 ounces just happens to be the right number. All right, let's do it. 90-degree angle to the floor, put my hand up there, get ready to say K, load it up, K. Just let it drip out, switch hands, other side, load it up, not onto the side like this, load it straight on, head 90-degree angle to the floor, K. Now, we know I have done a good job because all of it came pouring out the other side. That's where the win is. When it comes, it's not on the side that it goes in. It's when it dumps around the other side, that's when it cleans it up. Then real quick, blow your nose a little bit. Don't try to blow your head up with it, just a little bit of a blow, and you're done. Clean the bottle, pour out whatever's left. If you're in the shower, put it up in the shower head to wash it in, maybe throw a little baby shampoo, shake it up, then let it dry out. You're good to go for tomorrow. Thank you.